Hello everyone, I am Dr. Sunil Patil. I am consultant urologist, andrologist and a renal transplant surgeon working at Athayo Uro Care Center, Thane. Today we are going to give a brief information about RIRS surgery. RIRS, the full form of RIRS is retrograde intrarenal surgery. And as the name suggests, retrograde means something we insert from below upwards. So in this surgery, we insert a very small scope, very tiny fine scope from the urethra up into the kidney. As the name suggests, it has intrarenal in it. Intrarenal means we insert something into the kidney and operate. So a scope called ureteroscope, which is a flexible ureteroscope, it is inserted from the area from where we pass urine, that is the urethra. From there it goes up into the bladder and then into the bladder through the urinary tract of the kidney called ureter and then into the kidney. As the scope goes into the kidney, the interior of the kidney is inspected for the location of the stone. It could be a stone disease also, or it could be kidney tumors also, which could be small tumors or medium sized tumors. So we inspect the interior of the kidney for location of the tumor, size of the tumor, number of the tumor, as well as the number of the stone, size of the stone, and then we insert a fine laser fiber through the scope and then break the stone and make it into a fine powder using the laser energy. In case of tumors, the tumors are laced with the laser energy and it could be destroyed, or some part of it could be taken for biopsy for further evaluation, which could lead to further treatment. So this RIRS procedure is usually done in a single step procedure, but in some patients, almost around 10 to 20% of the patients have very thin ureter. Ureter is a tube which connects the kidney to the bladder, and if the ureter is very thin, for the build of the patient, if it is thin, then it is not able to admit the fine ureteroscope also, which could not enter through the vesico-ureteric junction, that is the junction between the ureter and the bladder. So if the scope is not able to go in, we may have to stage the procedure. While staging the procedure, what we do is that we insert a DJ stent, which is a pipe which is inserted through the ureter into the kidney, which goes into the kidney and the lower end goes into the bladder. And then we discharge the patient the next day. What the stent does is that when the stent remains inside, it helps in dilating the ureter so that the ureter gets expanded, and within a time frame of 7 to 10 days, the ureter gets expanded enough so that we can admit the patient again and undergo the second step of the procedure, whereby we remove the pre-existing stent and then insert the scope, flexible scope, which goes in very easily, and then the procedure can be completed in the next step. After the procedure is done, we may have to keep a stent again in selected patients where the stone load is very high or when the tumor is very big, so that there is some chance of post-operative bleeding, whereby the stent, if it is kept inside, it prevents post-operative pain as well as infection and fever. So if the stent is kept again, it may be removed after 7 to 10 days, which is a very minor day care procedure. So this RIRS procedure is very safe and very painless kind of procedure. Thereby post-operatively the patient does not have much pain and they may not require any analgesic or painkiller requirement also, and the patients are usually discharged the next day. So this procedure is really a path-breaking procedure in the field of urology, and it has massively improved the outcomes of the patient as well as massively improved the outlook of the patients towards the procedure. Thank you.